Welcome to Micro Health Talks, where we bring you insightful discussion on all things health and wellness. Are you at the best you can be? Because our body whispers in subtle signs of fatigue, brain clog, uneasiness, lethargy, mood swings. Because these signs could be clue of something that is happening hidden deep within our body. On World Irritable Bowel Syndrome Day, that is today, joining with us is Dr. Sajith Khan, Specialist Microbiology at Micro Health Laboratories today. Doctor, first of all, happy World IBS Day.
Thank you, Ms. Alka. It's always a pleasure talking with you. Thank you so much.
Thank you, Doctor. Doctor, to begin with, as it is World IBS Day, let's crack it on what is Irritable Bowel Syndrome and why it is so relevant these days.
Irritable bowel syndrome, as the name says itself, it is a syndrome. So syndrome means actually there is no definite cause for this. There's no real pathology. So it's a condition with a group of symptoms actually. So this condition is actually, it's very worrisome actually, because many people face this problem. They are not able to reveal this because of their digestive issues. So this actually, it is characterized by abdominal pain, abdominal discomfort, bloating, like constitutional symptoms, like they will have constipation or diarrhea. Some of these symptoms can be minimal, which can be resolved with your proper diet, lifestyle practices, and also if you reduce the stress also, all this can be, you can get rid of this. But some symptoms are more severe, where you require a doctor for your treatment as well as for counseling. So this is not a real cause, but a condition.
Doctor, likewise, how do you define gut microbiota and why gut microbiota is called the second brain of the body?
Yes, gut microbiota, see, from our childhood days, it's a complete ecosystem of microbes which are present in our gastrointestinal tract. It is composed mainly of bacteria, virus, fungi, even algae, protozoans. They are all beneficial to our body actually. They have many functions, like, and they live as a community. We call it as the microbial population. They really help us in our nutritional metabolism, in the defense system against invading pathogens, and also in regularizing the immune system. And also they can synthesize many vitamins, or many, like vitamin K and water soluble vitamins. So it has many functions. So that is why it is very important. And if there is a diversity in the population, that will bring in more symptoms in our body. So that is why it is important. And second brain, you said, because all these are controlled by the enteric neurons, which has a direct communication with the brain. So if any poorly coordinated signal which happens between the brain and the intestine, that can cause changes in our digestive processes. So that is why it is called as brain. And anything which any deviation or any changes which happens in the intestine, it will be picked up by the brain.
Brain first.
That's why we call it as gut as a second brain.
Second brain. Okay, doctor, similarly, 70% among the worldwide population, 70% of people aging from 18 to 44 are prone to IBS.
Exactly, because they say like IBS is very significantly seen in under 50 years of age group because of stress. See, we experience a lot of stress in our day-to-day activities, like even the school children in school, because of their homework, the stress, the classes, and our workplaces. All the stress can worsen the IBS symptoms. But it is not the only cause for IBS. So that is very important. That's why at a younger age, we are getting exposed to more stress. So that can precipitate these type of infections.
Okay, so you mean to say these are the triggering factors which will lead to IBS?
Yes.
Okay, and doctor, like why IBS is most often called as always undiagnosed or the most misunderstood symptom?
Yeah, it's a very good question actually. Because see, whenever the patient comes with these type of intestinal signs and symptoms, there should be some pathology. Because of that, these type of symptoms the patient may experience. So the healthcare professional, first they will try to rule out what are the common causes which can cause all these types of symptoms. Like for example, these IBS symptoms, they mimic that of celiac disease and the lactose intolerance. So the doctor first tried to rule out all these conditions, and ultimately, if all these conditions have been ruled out, and ultimately they will think about this IBS. That is why we we say that it is often undiagnosed.
Undiagnosed. By then it will be like worsened, or do you think it will be late?
No, I told you before, the symptoms may not be severe in many of the patients. It will be very mild only, and which can be resolved by proper lifestyle practice, including your diet and exercise. But some patient, it will be worse.
Okay.
Like for example, the complications, if you see, the patient may go in for weight loss. There may be bleeding, rectal bleeding. There may be iron deficiency anemia. Diarrhea occurring only in the nights. All these are alarming.
Okay.
So where you require medical attention and proper treatment for the condition.
Okay, since you were mentioning about lifestyle, doctor, so this will come under a lifestyle disease, or is it hereditary?
It can be both actually. Hereditary, of course, there will be a family history because the sharing of genes, that is also a very, very important factor. And also it is very common in females because one study in US, it says that estrogen therapy for the pre and post menopausal stages can be a risk factor for IBS symptoms. That is also there. So, I told main problem is the food habits. The food and stress are the main triggers for this condition.
Okay. So, how stress and IBS is correlated, doctor? Like, I understand food and lifestyle, yes, as a part of lifestyle. How stress is correlated?
See, again, it is about the gut microbiota. See, many of the microbes which are present in our intestine, they also synthesize certain neurotoxic metabolites, like for example, ammonia, lactic acid. All this will directly affect the brain functions, and also this will when brain is affected, the brain function is affected. It will have an effect, negative effect on our sleep habits, also our stress responses.
Certainly.
That is how it happens actually. It all triggers actually.
Yes.
It is not a definite cause.
Okay.
Definite cause is mainly because of the dysbiosis. Dysbiosis means diversity in our microbial population, which are present, which are lined in our intestine. See, billions of microbes are present in our intestinal tract, right from our childhood, still evolving. It will be evolving till our lifespan.
Okay.
So when there is change in the population because of certain conditions, so that will have an impact. That will create all the signs and symptoms. So that has to be restored. Ultimately, the final treatment option should be restoring that.
Okay.
And many new investigations are going on actually. There is one investigation called as FMT, fecal microbiota transplantation.
Okay.
That is basically, it's still under investigation, but clinical trials are going on. What they want to do is they will try to restore the healthy intestinal microbes by taking the processes tool from another patient and inoculating into the colon of the person with IBS. So that will restore the microbial flora. That will increase the microbial the flora will again, it will come back. So that is one particular advanced investigation is going on actually.
Okay.
If that comes, that will be the future in treatment.
Okay. So you believe this is going to be a groundbreak? Oh, it's ultimate. Okay.
It will be the ultimate actually.
So as we were mentioning about investigation and the solutions, like how do you think the best ways to diagnose IBS?
See, diagnosis actually, it's very difficult because it is all based on the signs and symptoms of the patient. So what the healthcare professional will do, he will start with a complete medical examination, like a physical examination. And as I told you before, he will try to rule out other possible causes. Like another important condition is there in the intestine, that is called IBD, inflammatory bowel disease, which is mainly of Crohn's disease, ulcerative colitis. and also the celiac disease. So they will try to rule out all this condition. Once that is gone, there are certain criteria. I don't want to go more into the diagnostic aspect because clinicians, they know.
Yeah, indeed.
They call it as Rome criteria because they'll see whether these symptoms, whether it is more or with constipation, whether constipation is predominant, whether diarrhea is predominant, whether it is mixed or unclassified. So they will take a complete examination, history from the patient, and they will try to categorize. So at which stage this patient is having the real problem.
Okay.
That is one sort. Additional tests like they will go for colonoscopy. They can do even CT scan, abdomen, pelvis, upper endoscopy. Apart from this, the laboratory diagnosis is mainly to look for the lactose intolerance. Stool test they do, breath test they do. Sometimes bacterial overgrowth can also will trigger these conditions. So all these are the diagnostic aspect. And finally, the newer thing, the new one which is coming up is to look for the entire microbiomes. Microbiomes means including the genes along with the microbes.
Okay.
So we want to have a comprehensive microbial population which is lining our gut. Based on that, based on the different microbes, or if it is whether it is decreased or increased, whether it is altered, that is called dysbiosis. Based on this, you can plan your treatment.
Okay.
So it helps you in tailoring a personalized diet, lifestyle, also therapeutic options to improve your health outcomes.
Okay.
And also it will give you, sorry, I'm just continuing.
I'm curious, so are the viewers.
See, main thing, it helps the clinician to prioritizing your treatment option. That is very important. See, sometimes we may not know which food to avoid because food is a triggering factor. So which food to avoid, which has to be continued, how long you have to take the food which is rich in fibers. Sometimes that may not be good also.
Certainly.
Certain people, they focus only on plant-rich foods. That is also may not be good.
Yeah.
So all these are very important. So this genetic testing, this microbiome testing is very, very important. Where they will tell you the personalized treatment options. They will tell you the probiotic suggestions, and also it helps the clinician in managing the patient.
Right.
So these things are very important.
Okay. So, doctor, the trend of the days are, go vegan or probiotics, prebiotics. Do you think these are worth the hype?
See, again, probiotics recommendation blindly over the counter we get, but we don't know. Suppose the common probiotics which we use is the lactobacillus. So we want to recreate the flora, the lactobacillus flora in our gut. But we really don't know whether there's a depletion of lactobacillus or not. Only with this microbiome testing, we will come to know exactly what is our microbial population. Based on that, if we recommend the probiotics, it will be helpful. Otherwise, over the counter, you take any probiotics, it is of not much useful.
Yes.
So
Since
it has to be checked and then it has to be prescribed.
Yeah, that should be a very strong message to our viewers.
Yes.
Since a lot of influencers, we don't know how accurate the message or the information they give is. Everywhere we hear is about vegan diet. Everywhere we go here is about go for probiotics, no prebiotics.
Now, prebiotics also will be recommended by this testing.
Testing, okay.
Actually, it's very interesting because what they do, it's a simple test from stool sample. So from the stool sample, you just try to isolate the DNA. And then you do a sequencing of the DNA. See, this is based on AI technology, artificial intelligence technology. So there will be bioinformatics as well as the artificial intelligence technology. So it will give a real insight of the microbial population, whether there is a diversity. So what has to be given, what food preferences should be given.
Rightly.
So all this exactly it will give. So based on and it will be easy for the clinician to start managing the patient based on that report actually. Because sometimes the patient will say, when I get this particular food, my symptoms get worse.
Yeah.
Another time it may not happen. So exactly what is the triggering food stuff he cannot define. Some, and we should also rule out other causes like food allergies, food intolerance. These things, food allergies is very rarely it will cause IBS, but food intolerance is there. Particularly, see, very commonly people what they say, they get intolerance because of wheat, certain nuts and beans, certain citrus fruits, carbonated drinks, milk and milk products. So all these are very important. Milk and milk products, you may get lactose intolerance.
Yeah.
Gluten, which is a protein rich in wheat. Because of that, you get celiac disease. So, but most of the time, you cannot define which particular foodstuff will trigger this problem, for which this test will help you out.
Okay.
Exactly, you can see, because, for example, I told you the gut microbiota, it is of billions of microorganisms, mostly the anaerobes and the aerobes. Aerobes are those which grow in the presence of oxygen. Anaerobes, they require carbon dioxide. For example, a food which is rich in proteins, an animal fat food, they are always associated one particular bacterial type that is called bacteroids, which is an anaerobic bacteria. Suppose so this association is very important. Based on this, you can prescribe what type of food can be. Some foods which are rich in, suppose if the flora is reduced, you can prescribe these foods actually, protein-rich food, animal fat food, to restore those flora.
Okay.
Likewise, for example, carbohydrates. Carbohydrates have an association with another bacterial type called Prevotella. Suppose based on the test result, if Prevotella, the community is reduced, you can prescribe carbohydrate rich food. In general, they call FODMAPs, FODMAP, FODMAPs.
Yeah.
Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are actually sensitive foods,
Okay.
because these foods you usually get from milk and milk products, from fruits, from vegetables. So people who are sensitive to carbohydrate products, they should avoid that. That they quote as FODMAPs.
FODMAPs, yes. This is a trending ways.
Yes, basically it's very difficult actually to point out one particular foodstuff is triggering your problems.
Okay. And yet again, doctor, like it remains a stigma. IBS remains a stigma, and also this is most ignored part. Like whenever if we feel discomfort, we blame it to something else, and we
Yeah.
go for a comfort food, and we don't give much of an importance.
That is
So-
again a big worrisome actually,
Yeah.
because they are usually shy. They don't reveal that they have some digestive issues.
True.
What happens invariably? This may lead to delay in the diagnosis and treatment.
Which will worsen in future.
It will worsen and it will go in for complications. I told you, this a long-lasting constipation. If the
Yeah.
patient has, they may go in for hemorrhoids.
Okay. Does it also result in colon cancer? Is there any relation with that?
No, they don't say that colon cancer. It's not a risk factor for colorectal cancer. That what I heard actually.
Okay.
There's no risk for colorectal cancer. So that's a good thing actually.
Yeah. So, doctor, like having said all these informations about IBS and gut microbiota, what is the message that you would love to give to our viewers?
Well, again, it's very very tough to explain, because whenever you have IBS symptoms, we know that there is no real pathology unless there are triggering agents. So only thing, avoidance. You have to avoid that particular foodstuff, but you should know which particular foodstuff is provoking this issue. And again, if once the gut flora is disturbed or altered, the dysbiosis, you have to restore it. So what I feel is, ultimately, if things are not improving, if the condition is there for a very long time, they can always try this microbiome testing. That will really help you in knowing your own gut flora, whether the diversity is there or not, or the real composition of your gut based on the microbes. The composition of the microbes, you can know which food you can take more, like whether you can have a preference on carbohydrate rich foods, or you can go in for protein rich food. Like that, you can have your own preference. And also, for clinicians also it will be helpful.
Yeah.
They can also very well prioritize their treatment options. So, and ultimate, again, these are all, again, it's not very definitive actually. Maybe in future we may have a proper definitive treatment option for this condition. Like I told you, that FMT, the fecal microbiota transplantation, that is also very important. That eventually it may come up.
Yeah.
So we have to wait for that. Till then, it is symptomatic treatment. Based on the signs and symptoms, you have to relieve the pain. So based on that, it is all symptomatic treatment. But this particular test will help you what could be the real cause. So that is how it should be.
Okay, so Dr. Luke, to conclude, shall we give a message of like ultimately at the end of the day, you are what you eat.
Yes.
And
See, there are certain basic take-home messages, treatment point of view is concerned. Like, please get away from the food which is going to trigger or worsen your condition. Always try to have food which are rich in fiber content. Drink more of fluids.
yeah.
Have good sleep, and also do regular exercise. These are the basic treatment modalities for this condition. So, and also avoid stressful condition, make yourself cool, not to indulge in very tough activities. All this can minimize your conditions.
Okay.
And symptomatic treatment
Treatments.
according to your constipation, your diarrhea, your bowel spasms. So based on that, you can have then and there symptomatic treatment.
And also treatment at the right time.
Treatment at the
Breaking
right
the
time.
stigma.
Very important. Very
Yeah,
important.
yeah. So having said that, in this era where like we all juggle in between a balanced food, lifestyle, exercise, our work, family, proper sleep,
Yeah.
and stress at the end of the day, it's very important to make sure that are you at your best of what you can be. So with this profound message and with the valuable inputs we have got here, Micro Health Talks signing up for today. Thank you, Doctor.
Thank
You
you.
so much. And once again, happy IBS Day to you all.
My pleasure. My pleasure.
Thank you.
Thank you.